Good afternoon. For our update today, we'll be talking about the two time periods since our last press briefing on Saturday. So for the first period, from Saturday to yesterday, we had 39 new cases who tested positive in BC, bringing our total to 1,987. And then in the second period, from yesterday to this morning, we had an additional 11 new cases, bringing our total to just under 2,000, 1,998. So the total since Saturday, our last report, was 50 new cases here in British Columbia. That includes, over the weekend, 2 additional long-term care facility outbreaks in the Fraser Health Region at Valhaven Manor and Valhaven Home and MSA Manor. In both these cases, a single person was identified with COVID-19, and the outbreak response teams from Fraser Health have been involved in both facilities to assess and to manage the outbreaks in those cases. One additional outbreak has also been declared over from a long-term care home, that's Central City Lodge. So we have now 12 long-term care facility outbreaks that are over. We currently have 21 long-term care or assisted facility outbreaks and 3 outbreaks in acute care units, for a total of 389 people in those units or in those facilities who have tested positive. As you are aware, we have a number of community outbreaks as well, and we've had some increases with testing over the weekend at the Superior Poultry worksite, where we now have 25 people who have tested positive, and there's an ongoing investigation and testing of contacts and family contacts of people from that facility, and additionally we are up to 34 people from United Poultry who have tested positive. I reported on Saturday that we had done a lot of testing at the Mission Federal Correctional Institution, and we remain at 118 cases identified at that institution, including 106 inmates and 12 correctional staff. In addition, we've had 11 people now in the province associated with the outbreak at the industrial complex at Curl Lake in Alberta, and I want to talk a little bit about that some more. I had identified that this was an issue because we have close ties between BC and Alberta around these movement of people for this essential work. Many BC residents continue to travel back and forth for the work that they have in both places, but in Alberta as well. And to date, while we have 11 positive cases, we know that there are several hundred people who are associated with that workplace in Curl Lake, and we know that they've got various degrees of information from their employer about the outbreak. So I mentioned this last week, or I made you aware last week, that anybody who has been in the Curl Lake project since March 24th or is in close contact with a worker who is ill and who has concerns needs to immediately self-isolate, and if you are ill, to contact public health. We have been given a list of names, and we are going through across the province to try and contact individuals who were associated with that. It's been a challenging process as we don't all have contact information for everybody, so I want to make it very clear that we continue to have cases reported in BC and in other provinces in Canada and Alberta that have been associated with the facility in Curl Lake, and we need people to be very aware of that, and if you do have any symptoms at all, to stay away from others and to contact us either by calling 811 or calling your healthcare provider or local public health. In terms of our case status, we now have 97 people who are in hospital in BC, and of those, 36 are in critical care or ICU. Over the last 2 days, we've additionally had 3 more people who have died from COVID-19 here in British Columbia, bringing the total number of people who have died to 103. And as always, we send our condolences and our thoughts to the families and to the caregivers of these people.